What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on Tuesday, March the 29th. It's a pleasure to have you with us. And I've got another one of my friends with us, Dr. Philip Batson from Columbia Healthy Smiles. But Dr. Phil is here by himself today. You were here last time too.
Yeah.
Because, well, Dr. Elizabeth Abe was expecting a baby.
Yes.
Since that time,
she has had the baby. We have a healthy baby boy at home now. So we have two boys. And so she is getting some much-deserved R&R and also taking care of the newborn. And both mom and baby are healthy and doing great.
Good to hear that. Well, you'll have to bring the new baby with you one of the times when you come. Okay?
Get his debut.
we got the important stuff. We got the important business taken care of first. The new baby that came to the Batson house.
Absolutely.
But of course, Columbia Healthy Smiles. We talk about good dental health. And there are a lot of myths floating around about good dental health. And I was looking them up on the internet, and I thought this might make an interesting topic. So how about if I just go down through some of the myths and you give me the answers to this?
Sounds good, yeah.
Myth number one, sugar causes cavities. Now, we all think that if we eat candy and a lot of sugar, it's going to that sugar causes a cavity. Is that true or not?
Not necessarily. Sugar can be a contributing factor to cavities forming, but it's the bacteria in your mouth and how they feed on that sugar. So eating sugar without cleaning your teeth, or then even eating things that break down into sugar, what people don't realize is a lot of foods like crackers, goldfish type things that are carbohydrates, if they sit on your teeth, those carbohydrates break down to sugar eventually as they dissolve in your mouth, and bacteria love that stuff. So it's not just necessarily a candy or a soda. Yes, those sugars aren't great for your teeth either, but you have to get that physical debris off of the teeth so there's not the food or the feeding area for the bacteria to eat on.
Okay, so that really is a myth then. Yeah. Sugar itself does not cause cavities. It's the sugar that the bacteria
the bacteria are causing that decay. Yep.
Okay. Myth number two, bleeding gums are normal.
No. Bleeding gums are a sign of inflammation and gum disease, actually. It's the way your body is telling you that there's inflammation in your gums, that there's probably a bacteria overload in your gums that's causing them to be sensitive and to bleed. And so it's kind of the way that it's showing, your body's showing and telling you that, hey, there's a problem here.
If you have bleeding gums once in a while, is that anything to be alarmed about?
Once in a while, maybe not. Maybe you got food stuck in an area, or maybe there was trauma to an area, and when you're trying to clean it, trying to help it, that can then, the gums can be sore and sensitive, or some people have a particular trouble spot, where food gets caught a lot or extra things build up. And so, yeah, if it's periodic and not all the time, but consistent bleeding gums are not normal.
Okay. Myth number three, brushing harder cleans your teeth better. Now it would seem to make sense.
That is actually something we talk about with patients every day. And that's not necessarily true. We really encourage soft bristle brushes and toothbrushes or electric toothbrushes, and we encourage gentle brushing. So when you're brushing your teeth, you're clearing off the debris, the plaque that builds up on your teeth, and plaque is really soft, really mushy. It doesn't take much force to get it off. So when you're in there scrubbing really hard, you're not doing any extra benefit to your teeth. You can actually do harm to your gums by brushing too hard. So we really encourage proper technique, and we educate patients every day on the proper techniques when they're in for their checkups and cleanings, and we educate on gentle brushing.
So use a soft-headed toothbrush.
Soft bristle toothbrush.
Then why do they even sell the hard toothbrushes?
because people buy them, because it's kind of that placebo effect. They feel like it's doing more. But I would save the really stiff bristle brushes, for cleaning your grout or something else, not your teeth.
Not your teeth. All right. Myth number 4: flossing is not really necessary.
No, I know there's been some articles and things in the news over the last few years talking about flossing, but flossing is very important. It does the physical manipulation of the gums. It physically goes in and breaks up any buildup things between the teeth. You're getting down below the gum line. When we were talking about bacteria earlier, you have bacteria, below your gum line. That bacteria doesn't like oxygen. It's what we call anaerobic bacteria, and so to get the floss down below the gum line, it goes in, it stimulates the gum tissue, but it also breaks up, gets agitates the area. You can bring oxygen down and below the gum line and help break up those areas where that bacteria likes to stay and do damage.
So the bacteria doesn't like the oxygen?
Yeah, there's different types of bacteria, but the anaerobic bacteria is one of the types down there, and it does not like oxygen. So if you can get in there, agitate the gum tissue, get debris out, get what it's feeding on out, just get the physical debris out, and plus it stimulates the gum tissue. It's kind of like when you go to the gym and you work out, you're building muscle, you're lifting weights, you're building muscle, but then so with the gum tissue, you're going in there, you're exercising that gum tissue to toughen it up, because eventually it can help prevent bleeding gums and just create healthier gum tissue overall.
Okay. My question then here, this isn't a myth, but can you use the water pick as a substitute for flossing? Does it do as good a job as cleaning as flossing does?
It does a great job at cleaning when used properly. And so it can go in there, it breaks up the debris, breaks up, can flush out the pockets, and things. I still like flossing for the physical, work on the gum tissue, but the water picks are great at cleaning. I like the water picks in conjunction with flossing, of don't let it be your full substitute. Use both of them, because they both have their benefits.
Yeah, I use the water pick every day, and it's amazing how much gunk you get out of your mouth.
I call it's a power washer for your teeth and gums. Yeah,
it is a power washer. It is a power washer. It gets everything out. But you're saying even though you use the water pick, it still is important to floss.
Yeah, it's just that physical manipulation of the gum tissue, just keeping it strong and giving it that physical workout.
Okay, you know what, Phil? There's probably about 6 or 7 more myths. Yeah. We ran out of time with this, but if it's okay with you, we'll pick it up where we left off next time.
Absolutely, yeah.
Okay, so as we're closing here, the most important thing to do. And I learned something from you. If you can't brush after your lunch meal, is to just take a mouthful of water and swoosh it around in your mouth, kind of rinse your mouth out.
Yeah, break up the sugars that get on your teeth, break up any of the food debris, just to have less food for the bacteria to feed on.
Okay, so if you can't brush after your lunch meal, just go into the bathroom and rinse your mouth out. And that's almost, not as good, but it helps. If you want more information, you can contact Phil and Dr. Abe at Columbia Healthy Smiles. Phone number?
573-875-7071.
Okay, and remember, go to the dentist for a healthy smile. It doesn't hurt. Bye-bye.